Welcome back to Therapy Thursdays. We are Fyzical with Louisiana Living, and today we're going to be talking about back pain because 80% of the population is going to experience back pain, and we want you to know what to do if you experience it and how to get better. So I'm Angela Yarborough, and this is my husband, Dr. Jerry Yarborough.
Welcome back. Again, I am Dr. Jerry Yarborough with Physical Therapy and Balance Centers. And today I am going to be talking to you about low back pain and sciatica. Now, I'm going to show you a little bit of the anatomy first. Okay, first we got the human spine here. We start up at the top with cervical segments. Now, we have 7 vertebrae, which is the bone of the spine. In the cervical spine, and then you go through the thoracic spine, we got 12, and then the lumbar spine, we have 5, and then you go into the sacrum, which again we have 5, and then the coccyx or the tailbone, which we have 2 or 3 segments. Now, as I mentioned, I'm going to talk about sciatica. Now, what sciatica is pain that shoots down the leg, and we're going to talk about a few different ways that can happen. And today we're talking about one of the 3 most common causes, which is stenosis or arthritis or degeneration. There's a lot of medical terms thrown at this, whether it's degenerative joint disease, degenerative disc disease, arthritis, spurs, all of that stuff. So we start off with a healthy spine. The bones are nice and smooth, and as we age, those bones become very jagged through different trauma that may happen, different wear and tear on our bones. And the bone will re-heal itself, and when it does, it kind of overheals itself and it becomes jagged. And many times that's called a spur. And then the disc is the cushion between the vertebra. And I like to think of the disc being a nice, fat, fluffy marshmallow when we're young. And then as we age, those marshmallows dry out and they become thinner and thinner and thinner. And as they do, in between each segment on the spine, they get closer and closer and closer. And in between each segment, those nerves that come out get impinged. So you've heard of a pinched nerve or an impinged nerve. That's how that happens. Now the nerves in the spine innervate your arms, the nerves in your low back innervate your lower legs, and when one of these are pinched, it's going to shoot pain down your leg and cause sciatica. Now come back to the next segment and we'll go over some exercises to help you today start to address this. So welcome back to Therapy Thursdays on Louisiana Living. I'm Dr. Jerry Yarborough, physical therapist, and this is going to be our last segment for today, in which we're talking about back pain and sciatica. And the first common cause that we're talking about today is stenosis or degeneration, causing an impingement on your lower back. The common signs for that for you to think of is if you're walking and the more you walk, the more your back hurts. That's a good sign that it's from degeneration or stenosis. If you see someone in the shopping store, in the grocery store, and they're leaning over on the shopping cart, or someone says, oh, just let me sit down for just a minute and I'll feel better. Those are all golden signs of degeneration or stenosis causing low back pain and sciatica. This is our office manager, Jamie, and she's going to be our patient today to demonstrate the 3 most common exercises to help you if you have low back pain and sciatica caused by degeneration or stenosis. So go ahead and lay down. All right, go ahead and bend your knees. All right, so I want you to use both hands behind your thighs here and pull both knees up toward your chest and try to hold. You can try to hold for 30 seconds if you can, and then come back down. Now, what this is doing is this is opening up that lumbar spine to unimpinge that nerve that's causing you pain. Another good exercise is just in the same position, feet together, knees together, and you're gonna rock your knees side to side as far as you can without causing significant pain. This is a good low back stretch. Helps open up that lumbar spine and will help decrease your pain. You can do these in bed before you get out of bed every morning or anytime you're experiencing pain. Our third and last exercise for today is going to be what we call a piriformis stretch. So put your foot over your opposite knee. You're going to pull your knee up toward the opposite shoulder with your hand. Okay, you're going to hold that for 30 seconds, and then you're going to come down and you're going to move your hand here and you're going to push down for 30 seconds. And that's called a piriformis stretch, all right? So remember, if standing or walking longer distances cause you to have back pain, you could have pain from the stenosis or degeneration. So these are the exercises you want to try to do. Now there are lots of causes of back pain. So come back next week, we're going to be talking about the second most common cause of back pain. And if these exercises don't give you the relief you need, remember, Fyzical, we are the experts of balance and back pain. So reach out, give us a call. Here at Fyzical, you can catch us on our Facebook or YouTube.